Welcome to Under the Microscope.
Brought to you by the Right Credentials Network and your host, Dilsa Bailey, a certified medical services professional for over 20 years. Under the Microscope is where we will examine the many layers of the medical services profession using the acronym SCOPE. That's S-C-O-P-E, which stands for S, Services for Onboarding and Maintaining Providers in a Healthcare Organization. C, Credentialing and Privileging Providers to ensure that they are competent and qualified enough to treat patients safely in a healthcare organization. O, Operations and Data Management, utilizing the healthcare organization's resources efficiently and overseeing the security of its data, promoting patient and provider safety. And P, Provider Enrollment, affiliating providers with health plans and government payers so that the providers can get paid appropriately. And E, evaluating and monitoring provider performance to ensure patient safety. As a medical services professional in the healthcare industry, our primary focus is to promote patient safety. Though we do a lot, we can't accomplish this on our own. It takes a village to collaborate. That's why this podcast will also include the contributions of our healthcare partners with the same objectives. So stay tuned to hear from those other stakeholders in the healthcare industry too. Joining us, in addition to medical services professionals, will be experts in risk, legal, revenue cycle, quality, and more. So stay tuned. Keep us under the microscope so we can help expose all the little details of the medical services profession. We want you to remember how valuable you are to the healthcare industry. If you're watching this on YouTube, please subscribe, drop us a like, and hit the bell so you will know whenever we add the latest episodes. And in the meantime, follow us on LinkedIn or reach out to us at info@therightcredentials.com. In each episode, we will discuss a separate topic related to the letter in the acronym of the moment. But we won't be discussing it alone, as I mentioned. Each episode will feature a guest who will share their expertise, providing advice, training, and support wherever possible. So let's get started with the latest episode. And if you like this one, don't forget to subscribe on YouTube and continue to listen to us on your favorite podcast platform. Welcome to Under the Microscope, brought to you by the Right Credentials Network and your host, Dilsa Bailey. We're here under the microscope to help delve deeper into the many layers of the medical services profession. I want to make sure that everyone knows how crucial the medical services profession is, and I want us to be able to collaborate with each other a lot better. And I know that we can do this by talking. And I'd like to talk to as many professionals in the healthcare system or in the industry as possible. But today we're going to focus on SCOPE, our acronym for services, credentialing and privileging, operations and data management, provider enrollment, and evaluating and maintaining and monitoring provider performance. So with that said, we're going to focus on C, credentialing and privileging. I'm not going to talk too much about privileging today, but we're going to talk about credentialing. Credentialing can be looked at from different perspectives dependent on the healthcare organization type, but it's all pretty much the same. It's just that some organizations may require additional information more information than what the other one would require. For instance, a health plan may not require as many details to collect and verify as a hospital may, because the hospital would include privileging and peers and other items that they would need for in-service care. For credentialing, though, it's all pretty much the same process. But again, we're looking at it from different perspectives. So today, I want to look at it, what makes credentialing, what's required when we're going through credentialing, pretty much. So what defines a complete credentialing file? That would depend on the organization that you're working for.
the type of organization. They may have internal requirements. As I mentioned, the hospital may have more than the health plan, but they're also going to have to meet other requirements like CMS regulations for any Medicare or Medicaid products that they use. They may have to meet state regulatory requirements because each state has their own unique set of requirements. And then, of course, they'll want to show how qualified they are to attract patients to their organization. So they want to meet a benchmark, and that benchmark might be set by an accrediting agency. Now, the accrediting agencies are too many, there's not too many accrediting agencies, but there are enough that you know about, especially if you are in a health plan, you would know about the National Committee for Quality Assurance, NCQA. If you're with a health plan, or maybe you're in a delegated arrangement with a health plan, and you would know about NCQA accreditation too, because you would have to meet those guidelines. I've brought on a guest to talk to us about that today. She's a subject matter expert in NCQA because she is an NCQA accreditation consultant. And I'm going to introduce you to her and let her tell you a little bit about herself. Her name is Jana Altieri. Jana, welcome to Under the Microscope. How are you today?
Good, thank you. Thanks so much for having me on today, Dilsa. I appreciate it. So as Dilsa mentioned, I am an NCQA accreditation consultant. I work for an organization called Managed Care Consulting Pro, where I'm the founder, and really focus on helping organizations get through their NCQA accreditation, whether it be for an initial survey or renewal survey. And I work with various organizations from health plans, case management, credentialing, CVOs, the whole gamut of them. So thank you for having me on today, and look forward to talking to you.
Fantastic. And I'm glad that you have a wide range, just not credentialing, but we're going to focus on credentialing. And perhaps there might be some information that you can give the medical services professionals about how to interact with the other stakeholders in the accreditation process.
Sure.
That's within the organization. So let me start by asking you, what types of organizations should seek an NCQA accreditation?
Well, really any organization, healthcare organization that is really aiming to demonstrate their commitment to quality. So, really showing that they're patient-centered, that they're trying to improve their quality outcomes. There's various different accreditations, as I mentioned, health plan, case management. Those that do credentialing might be, credentialing ones that do verification only, or there may be more broader scope credentialing organizations that would go for the specific accreditation. Again, there's other organizations, I won't get into detail, but there's a whole host of different programs that NCQA has. But really it's for those organizations that really want to demonstrate their commitment to quality.
Awesome. Fantastic. Yeah. It's fun when they start deciding that they're going to become accredited, or they want to become accredited. What should they start, or when should they start preparing for accreditation?
Well, I usually like to tell my clients it's never too early to begin.
Okay.
It really is specific to the organization. So it depends on if they're already working within the quality framework, if they're already working within the NCQA standards. You may be doing some things you don't even realize that you're doing that are NCQA standards, because there are standards that are, across the healthcare, organization. But really, I usually say at least a year to 2 years, give or take. And again, that can really vary with organizations. But it depends on your business. It depends on your resources, how much staff you have available to assist with that, if you have your policies and procedures written yet, and if you are already working within those NCQA guidelines.
Okay, cool. Now, I just asked about if they should consider accreditation, who should consider accreditation, but there's not just accreditation with NCQA, they also have a certification. So who should consider certification as opposed to accreditation?
Sure. Well,
What
let me
type of,
explain the two programs because they are a little bit different. The accreditation for credentialing is more of a broader scope. It's a full scope credentialing. So that really entails those that do not just the primary source verification of credentials, but they do the ongoing monitoring. They have a whole quality improvement framework for their program. They're implementing interventions. They have a credentialing committee and a medical director that leads or is involved in the credentialing program. They do the full credentialing life cycle. They monitor actions against providers, complaints, adverse events, and they do ongoing assessments of providers. So it's a much broader scope. CVOs, the certification is focused mainly on the primary source verification. There's 11 different certifications that an organization can achieve through NCQA. So it's really on those that are focusing on mostly the verifications. Usually have a client like a health plan or another organization, a healthcare organization that they are doing the credentialing for. And also sometimes they may do the ongoing monitoring of sanctions. So it is a different in scope. Both types of organizations may, as I mentioned, contract with, a health plan, be a client of a health plan or some other sort of integrated health system. So they're acting as a delegate of that. So it's both similar types of function that they will provide, but much broader scope in terms of the accreditation versus the certification.
okay. So an organization that some large organizations have like centralized verification offices. So I guess it would be dependent on whether they also support the committees and the ongoing monitoring and all that good stuff, as opposed to just verifying data and sending it out to the other hospitals, whether they would want accreditation or certification.
Right. Yeah.
Okay. All right. When should you apply for accreditation, or how long should it do? What's your time frame for renewal? I guess for both there would be two different questions, but how soon would you apply, and what timing should you give yourself before putting that application in for an initial survey?
So for an initial one, what I usually recommend is first reviewing on the NCQA website the different programs to determine if you're eligible and which one you might be eligible for. And then I recommend setting up a meeting with NCQA to discuss your organization and the different nuances of it. And then they will give you an idea of, whether you are eligible for, which one of the programs. I would say at least a year, maybe more like a year and a half. What is important to know is that first survey, an initial survey, they have what's called the look back period. So that is typically 6 months prior to your survey date. So that look back period, you want to make sure you're in full compliance with all of the different standards prior to that look back period. So prior to that 6 months. So you want to think about how much time does your organization really need to become prepared prior to that 6 months. So that's why I say, if you look at the NCQA website, they will say a year. Certainly I've seen organizations do it successfully in a year or under, but I recommend really more like year and a half. Yeah. Even 2 years sometimes.
Yeah. I recommend that too.
Yeah,
Not everybody does it, but yeah.
Yeah. So that's just give yourself enough time and build in, just build in that extra layer of the unknown, I guess I should say.
Yeah.
So.
And then renewal, what's the typical time frame for the renewal application?
So typically it depends on what you've achieved. There's a 2-year accreditation and a 3-year accreditation for credentialing, based on what your score is. So they typically give you an idea when you receive that accreditation, you'll receive a letter. Then I think it's about just over a year, about 13 months prior to the renewal becoming due. They will reach out to you, NCQA, and they will let you know a reminder to submit your application. So you'll have to go through the application, pay another fee, and then get that survey scheduled. Okay.
All righty. Great. So preparation for NCQA, what should well, you mentioned policies and procedures. What else would you have to have in place? I know with credentialing, you really need to have your files in place, but other items, what else would they be looking for? Or how would you want to prepare what you're going to submit? what kind of advice would you give someone? Because I know if they're not used to it, it's going to seem overwhelming.
Sure,
What,
sure. Yeah.
you know, yeah.
So I think that, really the foundation of what NCQA looks for are definitely, as you mentioned, policies and procedures. So what they have different data sources, and the primary one I would say is documented processes. So that can be in the form of policies and procedures, standard operating procedures, desk procedures, workflows, any type of written documentation that will tell NCQA what it is you do and how you do it. Then the other data sources are such things as reports and materials, and then I'll get into files in a minute. But reports, the different standards have different reports. So they might be like ongoing monitoring logs, your sanctions monitoring, your complaint reports, your adverse event reports. Reports can also include credentialing committee minutes. So those are very important to keep good minutes. And one thing I like to tell my clients is document who says what. You can use initials, you can, not include the actual names of the providers, but at the top of your minutes, include their specialties and their titles. You want to have practicing providers on your committee. You want to have those that are actually practicing in your network, in your committee. You can't just be internal staff. So you really want to document very good minutes. Those will be provided as evidence, especially for credentialing. They really want to see that you are using a thoughtful process when you're reviewing those credentials of practitioners, and those practicing providers are weighing in on that, and you're having good discussions as to whether or not you should allow practitioners in your network or allow them to continue practicing. Mm-hmm. Other data sources they will review are materials. Those could be like practitioner letters, newsletters, emails, the practitioner rights statements that you send out, provider manuals. And then when you get into delegation, that refers to usually the contracts. So the delegation contracts have to have very specific language in them. So those kind of need to be reviewed right up against the standards. And then, as you mentioned, files. So file review is something that, NCQA they'll request in advance of the survey, the on-site survey, they will request your files, the file universe. They will then pull a random sample from that, and they will review both initial credentialing and re-credentialing files. And they will look for all the different verification sources, that you're using the appropriate sources, and that you're documenting them appropriately, and that you're meeting the appropriate timeframes. So that will be your file review. And that's why I say it's so important to get in compliance prior to your 6 months, because once that 6-month period, you're in that look back period, they can pull any file randomly from during that 6-month time frame. And file review is considered like a must-pass element. It's very important to the scoring of the accreditation. So you want to really make sure that you got all your processes in line, and you know what sources you're using, appropriate sources, and you're meeting your timeframes.
Awesome. Thank you. That was very comprehensive. I like that.
Great.
I'm sure that's very helpful to the listeners. Oh, okay. You mentioned the must pass. I noticed there's also automatic credit given for some areas. Are there any specifics that you can mention what they may get automatic credit for?
Sure. So automatic credit has to do with, delegation, as I mentioned. A lot of the credentialing accreditation organizations or the CVOs will act as a delegate to a health plan or another organization, which means they will, that organization will give authority to the credentialing organization to perform a function on their behalf that meets an NCQA requirement. So if that organization is NCQA certified or accredited, they can help that organization to get automatic credit for certain NCQA standards. So there will be more in the accreditation as a certification, as we talked about earlier, how it's a little bit more comprehensive. So for the certification, a health plan could get automatic credit for those primary source verifications in the file review. The surveyors won't need to, review the files for that verification. That will be, get a checkbox for that. You'll pass that. But there is more that a health plan or other organization can get credit for if they're contracted or they're delegated to a credentialing accredited organization. So there's some of the ongoing monitoring. There's, I think, about 3 additional standards, 3 to 3.5. There's a couple nuances. I won't get into the detail, but within the standards and guidelines, there's an appendix called auto credit and delegation. that you can refer to that really kind of shows the difference between a CVO and an accredited organization. So yes, there are additional, a couple additional standards that being accredited can help a health plan or other organization.
Awesome. That's very helpful. Oh, okay. Let's see. What else can I ask you? Oh, here's a good one. Who should be involved in the actual survey?
Well, I definitely recommend, the frontline, workers, those who do the day-to-day credentialing, processes should be involved, especially in the file review. They're going to be the ones probably to walk the surveyor through the files. They're going to know exactly what to show them and where. The person who's responsible for credentialing overall, usually a manager, director, should be involved. The NCQA on-site, they call on-sites virtual these days. At least it's still to date virtual. Usually it starts with an opening conference and then a closing conference at the end. I usually tell my clients, if they were to send out an invite to their internal staff, I recommend they invite optional attendees, some leadership of various departments that may be somewhat involved in practitioner network, say maybe provider network, or any touch point that has to do with for credentialing has to do with practitioners, or even membership, because as you know, credentialing, it does impact overall member satisfaction. I think it's important for the organization leadership to understand what is involved in an NCQA survey, so they get a little bit of the intro there, and then in the closing conference, NCQA will give you a pretty good idea of their findings. They won't be final or anything. They have to go to the review oversight committee, but they will give a good summary of their findings. They will talk about the strengths of your organization, and then, what your opportunities for improvement are. So that's who I typically, recommend being invited to that, but definitely the frontline people who do the day-to-day in and out credentialing, or who want to be very involved.
Okay. All right. Yeah. And that's very, important that everybody gets involved, so that everyone, even the frontline people will know how important it is to be a part of it and what they actually need to do to meet it. But they'll realize the importance of what they're doing every day as well.
Right, exactly.
Okay, let's see. How do you remain up to date on any of the changes to the standards? Every year they have a little change here and a little there, but this year coming up, I think they have some major changes that they're going to put in.
Right.
So how do you keep up to date on this?
Yeah, so NCQA usually publishes regular updates about 3 times a year. They typically seem to be around March, July, and November. They will, not for every type of program, but I think credentialing mostly has had an annual, updates, or at least annually, but it's always good to look at those, mark your calendar, put it on your work plan, whatever it is you follow, to kind of go out to the website and check under that, that section of the website. There's also FAQs that they publish monthly. And you can filter by the type of accreditation or certification to just see what's applicable to you. So definitely also sign up for the NCQA newsletter that comes out. They have good information in there. They have trainings on their website that are self-paced that I highly recommend. They have one specific to different, I believe they have a credentialing accreditation one. They have the health plan series, which there is a credentialing specific one. So that could even be, it's very, very similar credentialing. The credentialing accreditation compared to the health plan, a standard category of credentialing, are very, very similar, almost identical, but not quite. So, and then as you mentioned, be on the lookout for those big changes that might be coming for 2025. So back in this past winter, I think it was around January timeframe, they put out their open comment public comment period for their proposed changes for next year. And they were really some of the biggest changes I've seen in a long time. So for credentialing, how it would affect credentialing is they are proposing combining the credentialing accreditation and the verification program. So instead of 2 separate programs, as we talked about, they would combine them into one, and then they would have the various tiers of the different verifications and accreditation. They also proposed some pretty major changes to the timeframes for primary source verification. Some other less sweeping changes include some that I think might be a little bit better for the systems control piece, which is an area that, especially within the credentialing accreditation as well as health plan, have struggled with meeting some of those standards around the reporting requirements for those. So they're going to have, there's some proposed changes for that, but definitely some, I know that they did receive a lot of feedback from those proposed changes. So I'm not sure what they will take into consideration and if they will, make some changes to those, but definitely be on the lookout. I would say by this summer that they would be putting out the final version of the 2025 standards.
Yeah, I know a lot of people will be happy if they improve what the requirements are for the system controls piece, because that
Yeah.
is a little confusing.
It is. It is. I think hopefully I think when I reviewed that, it looked that they are trying to provide a little bit more guidance, because that has been a big area of confusion.
Yeah, yeah. And a lot of the changes too, used to be a lot of the changes would be just languages, the grammar or the language of how they addressed something. But
Right.
now this one is really going to affect everything.
Mm-hmm.
So yeah. So that's where you can look out for everything. Is there anything else you would like to tell us that that maybe I didn't ask in the questions, and anything that you would want to put everybody's radar up to make sure that they're doing in order to succeed and
Yeah, sure. I think one of the biggest barriers I find when I review, and this is across all different organizations, not just credentialing, um, over the years, and NCQA has really become, I think, more strict over the past several years. We went through a pandemic and then a lot of resignations. I feel like leadership in some organizations are not aware of the amount of time that goes into preparing for NCQA accreditation. They're not aware necessarily of the amount of resources that are needed. So I see organizations trying to do their day-to-day work of credentialing, which, as you know, is very cumbersome, very time consuming. Then on top of that, they're given the task of becoming NCQA accredited or maintaining accreditation. That is too much to ask. You really need to have additional staff members. If you have a lot of delegates, you really need a specific delegation oversight coordinator, for instance, for credentialing accredited organizations. If you have a bunch of delegates, I really feel that this has led to inappropriate staffing, and this has put a damper on a lot of organizations where they're not able to meet some of the requirements around the analysis, the analytic pieces anymore. Some of the delegation oversight I see has been slipping just because they can't really keep up with it. And I think really the whole reason for doing credentialing in the first place is for our members, our patients, for having overall improved patient safety and good quality healthcare outcomes. And that we need to come back to remembering that. And that is the overall goal of NCQA, is healthcare quality. And I think that it's really important for organizational leadership to understand what is involved in the standard. So having sort of a NCQA 101 meeting with them, or a training, so they understand what is involved and what type of resources are needed, so they can provide that for their staffing. That is really something I see as really important, to having a successful survey.
that is and you're right, there's so many organizations that don't realize what it actually takes to get done. They don't give it the resources until the last minute.
Exactly. And then you've been through your look back period and you can't go back and change things. So that's why it's very important.
Yeah. So everybody take that to heart, please. Well, thank you for sharing that with us. I want you to share your contact information. So if anyone wants to get in touch with you to learn more or to get your help, tell us, I'll add this in our, on YouTube, they'll be able to see it, but tell us how to get in touch with you.
Sure. You can certainly go through my website, managedcareconsulting.org, or my email, and I'll have to provide it, but it's my jaltieri@managedcareconsulting.org. So find my website and you can contact me through that or through email. I'm also on LinkedIn. You can find me there. So I'd be happy to answer any questions. If anybody has any, interest about NCQA consulting, I'd be happy to talk to you.
Okay, awesome. Well, thank you for joining us, Jana. I really appreciate all the information. It was very valuable. And I want all the medical services professionals to listen to this a couple of times because you gave us so much information. I really appreciated it. And listeners, please, if you're watching us on YouTube, to hit subscribe, hit the like button, and hit the bell so you can hear about us again. And other medical staff services professionals need to hear this. So share it with your colleagues, please, and share it with the stakeholders in your organization because they need to know how to support you and how they should support each other in getting accredited and what the needs are. So please join us again. And thank you again, Jana, for all
Thank
of
you.
you.
Thank you for
I
having me.
appreciate it. Thank you.
And if you like this one, don't forget to subscribe on YouTube and continue to listen to us on your favorite podcast platform.